Hey guys, my name's Abbie Nash. I will be presenting on over-the-counter access to oral contraceptive pills, which are currently available in certain states, but not at the federal level. So my big question is, in order to make this a federal policy, would U.S. women be supportive of or interested in using oral contraceptive pills, or OCPs, if they are available over-the-counter, or OTC? Just some background. So there's growing evidence that over-the-counter access to OCPs is both safe and effective to control birth and to prevent unintended pregnancies. And the article that I'm going to be reviewing to answer this question is Grossman et al.'s article, Interest in Over-the-Counter Access to Oral Contraceptives Among Women in the United States. So in addition to the main question which they're answering, they are also looking at willingness to pay for an over-the-counter OCP, as well as their women's opinion of OTC access, such as the perceived benefits and concerns of receiving these type of pills over the counter. So this would be similar to the recent shift we've seen in emergency contraception available over the counter like Plan B. So Grossman et al. Gathered their data by using the Knowledge Networks panel, which is a nationally representative, probability-based, non-volunteer online household panel. So the CAN panel has been shown to produce more accurate results than simply telephone interviewing or internet data collection. So the sample that Grossman et al. Was looking for in this survey were females aged 18 to 44 who spoke English or Spanish. So this would be all women who are typically at risk of unintended pregnancy. However, in order to get the sample to those who were considered at risk for unintended pregnancy, they had to screen out certain categories of women. So during the screening, they looked for women who had had sex with a man at least once in the last 12 months, who were not pregnant or trying to become pregnant, who did not deliver a baby in the past 2 months, and who neither them nor their partner were sterilized. So following the screening, the survey occurred at the end of 2011, and 2,046 women both completed the screening and provided data for the survey. So the questions asked in the survey they described OTC as birth control pills available on a shelf at a drugstore or a grocery store, just like cough medicine or some allergy pills. You would not need a prescription, and insurance may or may not cover the OTC birth control pills. And in order to gauge support for the birth control pills, so not just would you use it, but would you support it, they asked, what is your opinion of birth control pills being available over the counter in pharmacies or grocery stores? And even if you're not interested in using those OTC pills yourself, are you in favor of OTC birth control being available for other women? So here are the results. I don't know if you guys can tell, the chart's kind of small, but among all respondents, 62% said they either strongly supported or somewhat supported OCPs being available over the counter. This particularly included women who had never been married or were living with a partner. They had significantly higher odds of supporting OTC availability. And 37% of respondents said they were likely to use OCPs if they were available over the counter. This included those who are currently using OCPs and would switch to getting refills over the counter. So that includes a multivariable analysis, which is all these different categories and columns, showed that the groups most likely to use OCPs if they are available over the counter were younger women, divorced or separated women, women living with a partner, women with private insurance or no insurance, and women living in the South. In regards to the perceived benefits and concerns of this type of availability, most women recognize the benefits that OTC availability of birth control would be more convenient. It would make it easier to get birth control. It would save time, it would save money, and it would make it easier to stay on birth control as well as prevent unintended pregnancies. So there's this perception that this type of medication would assist in preventing unintended pregnancies, which is its goal in the first place. The concerns included women might not get recommended cervical cancer screening because they're no longer seeing a doctor before being prescribed this medication. They might use the wrong type of pill for them, or that the insurance might not cover over-the-counter OCPs. In regards to the willingness to pay, the highest on average was about $20 that women were willing to pay for this type of medication. So to reiterate, in conclusion, over 60% of respondents said that over-the-counter access to OCPs they were in support of, and over 1/3 of those respondents said they would use an OTC pill if it were available. This suggests that women see that this would reduce unintended pregnancies, and respondents of all races, ethnic groups, and at every educational level had a similar interest in over-the-counter birth control. So far, we've seen that Oregon has already introduced a law that allows women to get access to OCPs over the counter if they fill out a self-assessment form so that the pharmacist can control the type of birth control that they get. This law was passed by a Republican with bipartisan support, which shows that this would be an effective method that would be supported by all types of lawmakers, and suggests that it would fulfill its its original purpose. So as we can see, although not quite a federal policy yet, there is potential that over-the-counter birth control would both be effective and supported by a majority of women in the United States, as proven by Grossman et al. So thanks, guys.